Hi, Miss Capitano. How are you today?
Hi, good. How are you?
I'm Erica. I'll be your PA.
How are you?
Good. How are you?
Good.
I'm just going to go over a couple pieces of information before we get started. Can you just confirm your date of birth for me?
Today.
Oh, wow.
28.
Oh my gosh, happy birthday. What a great way to spend your birthday.
Thank you.
All right. Well, I'm glad I get to spend it a little bit with you. So can you tell me what's bringing you in today?
I've had some chest pain
Okay.
that's like out of the ordinary. Like I've never had anything like that before, and like sometimes it's a little bit hard to breathe. Like when I'm going up and down my steps.
Okay. And do you know what you were doing when you brought it on?
Not really. It just kind of started happening.
Okay.
Like I said, like sometimes it's hard to breathe when I'm like going up and down the steps, but
Okay.
the chest pain just kind of.
And how long has this been going on?
About a week.
Okay, a week. Okay. And where exactly on your body is it?
Like pretty central. Like
Central? Okay. Okay, you said about a week. And you said you just noticed it when you were going up the stairs?
Yeah, it's harder to breathe when I go up the stairs.
Okay, and have you ever had pain like this?
No.
Okay, and was it like a gradual pain or?
Kind of, but it's pretty consistent now.
Okay. Okay, and has it been like constant since it started a week ago or?
Yeah, I mean it'll come and go a little bit,
Okay. Okay. And is there anything else besides going up the stairs that's been making it worse? Have you noticed it during any other things you've been doing?
but I mean just like more activity, but
Okay.
that's when I really notice it the most.
Okay. And is there anything you've been doing that's making it feel better?
I mean it's not so bad like when I sit and rest, but
Okay. So more you've just been relaxing, trying to
Mhm.
not do as much activity. Okay. And has it changed at all? Any in the pain?
not really.
Okay. Do you have any other symptoms going on besides this chest pain?
I did faint the other
Okay.
day. That was just
Okay.
once.
Okay. Wow. And has that ever happened to you before?
No. Mm-mm.
Okay. And did that happen, how many days ago was that?
That was 2 days ago.
Okay. And how long until you came to?
It wasn't, I don't think it was very long. I was with my daughter and she said it was just pretty quickly, but.
Okay. And what were you doing when that happened?
We were just in the kitchen and I stood up and
Okay.
fainted.
Wow, that must have been really scary. I mean,
Yeah.
that's never happened
Yeah,
to you
no,
before.
it's nothing like that's ever happened before.
Oh wow, I'm very sorry to hear that. And but it hasn't happened since then?
Just the once.
Okay. All right. And you said there's no previous history of this ever happening to you before.
Right.
Okay. And I'm going to go back into that a little more because that's really important. And I just want to ask you a little bit more about your chest pain. How would you describe it?
Just kind of like a consistent, it's kind of dull, but it's
Dull.
like always there.
Okay, that's always present. Okay. And does it radiate anywhere?
Mm-mm.
Okay. And on a scale of 1 to 10, 10 being the worst pain you've ever felt in your life, what would you rate it?
Maybe like a 5 or a 6.
Okay. And has it affected your daily activities at all? I mean, I know you said you've been
Yeah, like
doing
my
lots.
my laundry stuff is downstairs, so it's hard to go like up and down to do laundry.
Okay. Okay. All right. And have you noticed it occurring any more at different times of the day?
Not really.
Okay. And you said it's more of a constant thing that's been going on?
Yeah.
But it's exacerbated when you go and do more activities or walk up the stairs, something
Yeah,
like
that's more the breathing that's harder, but like the chest pain too, yeah.
Okay. Okay, so, all right, the breathing component. Okay, and alrighty, so I just want to ask you a little bit more then. Do you have any other like chest discomfort around like other activities like eating and things like that?
Not really.
Okay. And do you have any difficulty breathing, you said, besides upon like exertion?
Right, yeah.
Only then, when you're resting, do you have any difficulty breathing?
Not usually, no.
Okay. And then do you have any shortness of breath with that?
Sometimes.
Okay. Okay. And have you had any shortness of breath during the night?
I did wake up once where I felt like I couldn't breathe, but
Okay. And is this something that you've ever experienced before? Okay. And it was just one time, but was this within the last week of those
This is last
symptoms?
night,
Was
yeah.
last night. Okay. Okay. And what did you do to make it stop?
nothing. It just went away.
Okay. Alrighty. Yeah, we'll definitely look into that more because that's not comforting either to wake up during the night with that. Have you had any heart palpitations?
Not that I know of.
Okay. Any, you said the loss of consciousness that one time, so I won't go into any more about that right now. And have you had any edema or like excess fluid build up anywhere?
I don't think so.
Okay. Do you have a heart murmur? Do you know?
I don't know.
Okay. And have you ever had rheumatic fever or like strep throat that's progressed really far?
No.
Okay. And have you ever had an EKG done?
A few years ago.
Okay. All right. And do you know what the results of that were?
They said it was normal.
Okay. And have you ever had an echocardiogram done?
I don't think so.
Okay, so it's where like it's on ultrasound where they look at basically the flow of blood
No.
through your heart. Okay. And catheterization?
Mm-mm.
Okay. All right, so just because this chest pain can, I'm sure, carry over into other parts of your like normal processing, I'm gonna ask some questions just about like if you've lost any appetite or anything like that. Had lost appetite?
Not really.
Okay. Have you had any heartburn?
Mm-mm.
Okay.
Nothing like out of the ordinary. So.
Okay. All right. And have you had any nausea or vomiting with
No.
this? Okay. And have you had any indigestion?
Mm-mm.
I know you said the pain hasn't radiated anywhere, but no abdominal pain associated with this. Okay. Any excessive gas or belching?
Nope.
Have you had any jaundice? Like yellowing of the skin?
No.
Okay. A history of liver disease?
Nope.
Or gallbladder?
Nope.
Okay. How about your bowel movements? Have you been going?
Pretty normally.
Okay. What's regular for you? No noticing difference? Okay. And have you had any pain upon going to the bathroom?
Nope.
Okay. Do you have any food intolerances?
Not that I know of.
Okay. And have you had any past abdominal surgeries?
No.
All right. And any upper gastrointestinal problems like the stomach or anything
think
like
so.
that?
No.
Okay. And then I'm just gonna ask you some questions about your lungs. Have you had any cough associated with this?
No.
Okay. And any sputum?
Mm.
Okay. Any wheezing?
No.
Any coughing up blood?
No.
Okay. And have you said shortness of breath, but have you had any difficulty when you take a deep breath? Do you feel any pain?
Not really.
Okay.
No more or less.
Okay. And have you ever had a chest x-ray?
No, I don't think so.
Okay. All right. Well, now we're gonna jump back into where we were. Sorry to throw you off like that.
You do what you need to do.
I know. It's a lot of questions, but it's just really important that we are thorough, so don't miss anything. Okay. All right, so I'm just gonna go into a little bit of your past medical history, just because we haven't met before, and I just wanna see if there's anything that could have happened before that could have had some impact on why you've been experiencing this. Okay, so for your childhood illnesses and immunizations, do you know if you left your immunization record at the front desk?
Yes, I
Or-
did.
Okay, so they have it on there, so I won't be redundant with that, because I know we don't need any more questions right now. And I'll check with you with that, and then if you are not up to date on some, we can talk about this during your next appointment.
Sure.
Okay, and then as of now, do you have any history of hypertension or high blood pressure?
I don't think so.
Okay. Okay. Any diabetes?
Type 2.
Type 2. Okay. And when were you diagnosed with that?
About 5 years ago.
3 years ago. And do you go to like an endocrinologist or something like that?
Yeah, every few months.
Okay. And do you have any like ongoing problems with it, or do you?
No,
is it well managed?
they said it's okay. I have to take a pill, but
Okay, that's great because that can definitely lead to a lot of problems too if you don't get to the root cause of that. Do you have any history of hepatitis?
mm-mm.
Okay. And any asthma or COPD?
Nope.
All right. HIV?
Mm-mm.
Any thyroid disorders?
Nope.
Okay. And I know I've asked you before, but no history of like heart disease or anything like that?
Not that I know of.
Okay. And any cancer? All right. And lastly, any kidney disease?
Nope.
Okay. All right. So I'm just going to ask a couple questions about your obstetric history. Do you have any children?
I have a daughter, yeah.
Okay. You said your daughter because you were in the kitchen
Mhm.
with her. Oh my gosh. I'm sorry. That must have been very scary for her too. Did you get her mom?
Yeah, she's a little
Yeah.
shaken up.
That's very understandable. And how old is she?
She's 20.
Okay. I mean, at any age, I would not. I don't know what I would do if that was my mom. All right, and your menstrual history. When was your last cycle?
About 2 weeks ago.
Okay. And is it regular for you, or how often do you get it?
Yeah, pretty regular, like once a month.
Once a month, okay. And do you take any contraception?
No.
Okay. And are you sexually active?
Yes.
Okay. And is that with men, women, or both?
That's my husband.
Okay. All right, and I'm gonna go into some more questions about sexual history later on, but I know we just gotta throw the different questions in there at you now. Okay, so do you have any diagnosis of any like psychiatric problems like depression, anxiety, anything like that?
No.
Okay. All right. Okay, have you had any significant injuries or accidents as a child?
I broke my wrist when I was a kid. But
Okay. And do you know how old you were?
I want to say like 7 or 8.
Okay. And what are you doing?
I was riding my bike.
Oh, wow.
I like flipped over the handlebars.
Yep. Were you wearing a helmet though?
Yes.
Okay, that's very good. That's very good. All right, and was it casted or would you have?
Yeah.
Okay. And any further problems with it, or did it heal well?
Yeah.
Okay. Anything else? Any other childhood? Anything in the adult since you turned 18?
No, I don't think so.
Okay. All right. And have you had any hospitalizations other than your daughter being born?
Yeah, that was it.
Okay. And any surgeries?
No.
Okay. So I'm guessing your daughter then was a vaginal birth, not cesarean.
Yeah.
Okay. So I can double check with that. 'Cause some people, it's a very important day and they're not thinking about that.
Yeah.
They're thinking about getting to meet their baby. Okay. So I know I already have your immunization records on file, so I won't ask you any more about that. And so do you go regularly to get like mammography done or like imaging of your breasts?
Yeah, I do that like once a year.
Okay. And do you go to like an OBGYN
Mhm.
as well? Okay. Have you ever, actually, do you know what your last result was for the mammography?
They said it was fine.
Okay. Okay. Have you ever had a colonoscopy done?
No.
Okay.
My daughter's been trying to get me to do that, but
It's an important thing. I mean, I always push my parents to go to, just
Yeah.
because it's not a fun process, but it can tell them a lot just from being able to image the whole colon. And then, I'm guessing, do you get pap smears done then when you
Mhm.
go to your OBGYN? And do you know your last result, anything?
she said it was
abnormal?
fine.
Okay. And have you ever gotten a DEXA scan done, like for your bones?
No.
Okay. All right, so I just want to ask a little bit about your family now, if that's okay with you.
Sure.
Are both of your parents alive and with us today?
No, they're not.
Oh, I'm sorry to hear that.
Thank you.
And is that your mother or father or both?
Both.
Okay, I'm sorry. And how long ago did they die?
Mom about 5 years ago. Dad, I think, was like 9 or 10.
Okay. I'm very sorry to hear that. It's
Thank
been
you.
really hard to go through that. And what was it that caused them to die?
My dad was in a car accident,
Okay.
and then my mom had, she had heart issues. I don't know exactly what it was. I think it was something with one of the valves, maybe. I don't know.
I'm really sorry to hear that, especially to lose both of them so close together. I'm sure that must have been
Yeah.
really difficult for your family.
Thank you.
Are you doing okay with that now?
Yeah, no, I mean, they were older, so,
Okay.
you know, it was okay, but
Well, if you ever have any concerns or anything you want to talk about, please, I'm always here.
thank you.
All right, and do you have any siblings?
I have a brother.
Okay. And is he alive and well with us
Mhm.
today? Okay. And how old is he?
He is 60.
Okay. And does he have any like high blood pressure, any significant health concerns?
Yeah, he does have high blood pressure.
Okay.
I think that's it.
Are you guys close?
Mm-hmm.
Okay. So
Yeah.
at least was he a source of support for you?
Yeah, definitely.
Okay. That's really, really important. And then as far as your grandparents, maternal, paternal, are any of them alive and well with us
No.
today? Okay. I'm also very sorry to hear that. Do you know how old they were when they passed away?
I think they were all in like the 70s or 80s. I'm not sure.
Okay.
I was
Okay.
younger.
It's understandable. And do you know what they died of?
I know my grandfather on my mom's side had a heart attack.
Okay. Your maternal grandmother. Okay, and you're not sure about your grandfather? Your grandfathers?
No.
Okay. Okay. And your significant other, your husband, you said?
Yep.
How old is he?
He is 55.
55, okay. And how long have you guys been married?
About 22 years.
Oh, that's awesome. Very happy to hear that.
Thank you.
And does he have any health concerns or anything like that?
He has cholesterol issues.
Okay. Is it gotten too high with
Yeah.
cholesterol?
Yeah.
Okay. Does he monitor that?
His doctor has him on a pill for that. so.
Okay. Okay. Yeah, definitely very important. And then you said you have a daughter.
Mhm.
What is her name?
Sue.
Sue. Okay. And you said she's 20?
Mm-hmm.
Okay. Is she in college now, or what is she?
She is, yeah.
Is that hard for you? Is she close by?
She's not too far. It's about an hour, so it's good. We get to see her.
That's really nice, because I feel like any more than that, it's like it's a trip
Yeah.
to get there. And does she have any health concerns, anything like
No.
that? That is wonderful to hear. Okay, so I'm just gonna list off some, I guess you would say, some medical conditions that would be alarming or concerning, I guess, for medical history. And then would you mind telling me if you know of any of them? I know you know off the top of your head, but sometimes if I
Sure.
read them off to you, it can help jog your memory.
Sure.
It's a lot to remember. Okay, so any history of diabetes?
The type 2.
I'm sorry for you, but I mean, I'm sorry I didn't clarify that. But for anyone else in your family?
I don't think so.
Okay.
There might have been type 2 in one of my grandparents, but that was, I'm not
Okay.
sure.
Okay. Any tuberculosis?
No.
Okay. Any heart disease? You said your grandmother.
Yeah.
Okay, and she also had the heart attack.
Mhm.
Okay. And high blood pressure, we did talk about that. Any pulmonary disease, any lung disease?
I don't think so.
Okay. Any stroke?
No.
Okay. Any kidney disease?
Mm.
Any cancer?
One of my grandfathers, I believe, had cancer.
Do you know what type it was?
I want to say lung, but I could be wrong.
Okay. Do you know how long ago he was diagnosed with that? Like just an estimate, I know it can be difficult.
Not really.
Okay,
Sorry.
that's all right. Any history of migraines in your family?
Nope.
Any arthritis
Mm-mm.
or anemia?
I don't think so.
Any history of epilepsy?
No.
Okay. Mental illness?
I don't think so.
Okay. Any drug or alcohol abuse?
No.
Okay. All right, so now I get to know a little bit more about you, if you don't mind me asking.
Sure.
And where were you born?
I was born here in Philadelphia.
Okay. Born and raised what part?
The southern part.
South Philly?
Yeah.
Okay. It's a fun area. Actually, I was just down at an Eagles game. So
Yeah.
not too far from there.
Yeah, we love the Eagles.
Yep. We're doing good this season, so let's keep it up. What's your highest level of education?
I went to community college.
Okay. And did you get your associates in
Mhm.
there? Okay. Awesome. And what is your occupation?
I am a manager at a department store.
Okay. Awesome. Which one?
Bonton?
Okay. Do you have any exposure to hazards there? Like any kind of risks?
Not really.
Like that? Okay.
It's a pretty safe shopping center, so.
Okay. You feel comfortable working
Yeah.
there and everything too? Okay. So how many steps in your house?
There's the flight to the basement and then the flight going upstairs.
Okay, so 2 flights. Okay. And is there, so you have like the basement, the first floor, the second floor?
Yep.
Okay. All right, so I know we talked a little bit about like when you lost your parents, your brother was a big source of support for you. Did you have any other close family or friends that you used as sources of support?
Yeah, I have friends that live in my neighborhood and then, my husband and my daughter, so.
Okay, that's great. It's very important. Even just the day-to-day, you just need people there to
Yeah.
be there with you. Okay. And do you have any religious affiliations?
I'm Catholic, yeah.
Okay. And about how many hours of sleep a night do you get?
Probably about 7.
Okay, that's great. I definitely recommend keep that up and as much as you can get, I recommend. 'Cause I know most of us don't get anywhere near enough.
Yeah.
Okay, so would you mind giving me a look into your diet every day?
I'll usually make eggs in the morning
Okay.
and then I'll have a sandwich for lunch or something like that. And then I'll make dinner pasta or something like that.
Okay. Alrighty, and you said you don't have any dietary restrictions
No.
that you know of? Okay, and nothing affecting with the type 2 diabetes, you said? You don't have to,
I have to be careful, like, with, like, sweets and things like that.
okay, but you do a good job of making sure that you're
Yeah.
staying, okay, alright. How much water do you drink a day?
Usually like a bottle, and then maybe I'll have like a glass after that.
Okay, so about like, how much do you say, like, maybe how many cups? Like,
Like
say
3.
3 cups? Okay. And do you drink any coffee?
Yeah, like
Okay.
2 cups a day.
2 cups, okay. And how much alcohol do you drink a day?
I don't really drink every day. I'll have like a couple beers on the weekends, something like that.
Okay. Okay, and how much do you smoke a day?
I don't smoke.
Okay, and do you use any kind of smokeless cigarettes or anything, like tobacco?
No.
Okay. And what do you do to stay healthy?
We'll walk sometimes, like around our neighborhood, or
That's great. But like family
yeah, things
family
like that.
walks, it's wonderful.
Walk the dog.
Yes, that's great, because they definitely need that too. Do you wear seatbelts?
Mhm.
Okay, and do you have a smoke detector in your home?
Yeah.
Okay, great. And do you have like a high stress level?
No, nothing crazy.
Okay,
I mean, normal things, but
okay. Nothing that's really been pressing on your mind that you think's been potentially causing you to have any kind of problems?
not really.
Okay. And what are your hobbies?
I like to, take my dog for walks, like I said. I like to be outside with that kind of stuff. And, what's my hobbies? I don't know. That's pretty much it. Like, spend time with my family.
Okay, that's wonderful. Okay, and do you exercise, like how many times would you say you walk the dog?
Like once a day.
Once a day. Do you exercise any more than that, or is that your?
That's pretty much it. Yeah.
Okay. And do you or have you ever used marijuana or cocaine?
Not since I was in high school. I never used cocaine.
Okay. Okay. Okay, do you have any allergies?
Nope.
You know of? Okay. And are you on any medications currently?
Just for the diabetes.
The diabetes, okay, and is that, do you know the name of the drug?
I don't. I can let you guys know. I can
Okay.
call you with that.
Okay, that'd be great. And do you take it, how often do you take it?
Once a day.
Okay. And is it, I'm guessing orally?
Yep.
Okay. And do you know what the dose is?
I don't.
Okay, can look that up. Anything else? Do you take any like over-the-counter medications or?
I'll take like Advil if I have a headache.
Okay, but
that's
only
pretty rare. Yeah.
when needed. And what about like any vitamins or minerals?
I take a
things like that?
multivitamin.
Okay, that's great. Otherwise, no, any supplements or like old prescriptions? Like sometimes people just hold on to them.
No, I don't think so.
Alrighty. Okay, so now I'm just gonna go into what seemed like maybe a million more questions, but it's really important just to get like a good baseline of what's going on with you.
Sure.
So again, I'm sorry that is a lot of
No,
questions.
you're being very thorough.
Okay. I'm glad, because a lot of people don't have as much of a positive attitude, so I appreciate it. Okay, have you, are you your usual weight, or have you had any weight change?
No, it hasn't really changed.
Okay. Have you had any weakness or fatigue other than?
Yeah, just recently.
Okay. And I guess I should say this when asking you, if this is within the last 6 months. So
Okay.
obviously I now know about your heart, or I'm sorry, not your heart, your chest pain, and then your fainting, but anything other than those things too, please
Sure.
feel free to tell me. It's very important. Have you had any general feeling of being unwell?
Just the stuff, yeah, no. it's
Okay. Any fever?
No.
Okay. Any night sweats or chills?
Mm-mm.
Okay. Have you noticed any color changes in your skin, anything like that? Any rashes?
No.
Okay. Any lesions?
No.
Okay. And have you had any lumps
No.
you've seen? Any itchiness
Mm-mm.
or dryness?
No.
Okay. Any oiliness? Have you
Not
seen
really.
any easy bruising?
No.
Okay. Have you had any redness or paleness?
I don't think so.
Okay.